Thank you very much for the question. So what we are observing globally is that Omicron variant is indeed overtaking the other variants in terms of being the most predominant variant of concern that is currently in circulation. However, whether we are at the near end of the pandemic, it's still too early to tell. Well, it would be, we are very much in the middle of the current response to the ongoing pandemic. Now, available information do suggest that the cases that we are seeing from the Omicron variant are presenting with less severe symptoms in terms of a clinical presentation. However, this should not be labeled as being a mild variant of concern. And this could be thought of for three reasons. First, it is more transmissible. Because of it's more transmissible, the more transmissible a virus is, the more cases that we will see, and the more that there is higher likelihood for cases to become hospitalized as well by the sheer volume or the number of cases. The second reason is that variants of concern emerge as the virus mutates, and the virus mutates because of its ongoing transmission. In other words, if a virus has the opportunity to transmit and to transmit to more people, then it means there is more chances for a new variant may emerge. And therefore, it is very important to suppress the current transmission and to improve our vaccination coverage. The third reason with regards to Omicron, and this is also with other variants of concern, is the condition that we call the post-COVID-19 condition. This condition is what there has been reports in earlier variants wherein there are symptoms that are lingering for months after the recovery of this particular patient. Now, since COVID-19 Omicron variant has just been detected on November 26 or reported to WHO on November 26, then there is no data currently with regards to the possible post-COVID-19 conditions attributable or may be attributable to the Omicron variant. So while the current information suggests that Omicron produces the less severe type of the disease, we also know that it is more transmissible. And therefore, it is very important to implement the measures that we have in place in order to combat the SARS-CoV-2 virus. And this includes, first and foremost, vaccination. Vaccines are now available in Nepal, and I urge the Nepali people to get your vaccines. And even after getting the vaccines, please know that the vaccines does not stand alone. It's vaccines plus all of the other measures that we have in place. This includes infection prevention control measures such as wearing your masks, observing hand hygiene, avoiding crowded places, and doing proper cough etiquette, but also including all of the public health and social measures that we know that are known to be effective in terms of controlling the transmission of the virus. So please get out there. If you haven't received your vaccination, ask your local health offices in order to get the vaccines and get vaccinated and do all of the measures even after receiving the vaccination.